Good morning, everyone. Thank you for joining Health for a Change, Facts Over Fiction, Changing the Narrative Around SNAP Benefits. My name is Allie Wells. I'm the Communications Director at the Foundation for a Healthy Kentucky, and we're going to go ahead and get started as people are joining. We're really excited about this webinar today and are super appreciative of our speakers who put the time and energy into their presentations. Joining us today, we have Jessica Klein, a Policy Associate at the Kentucky Center for Economic Policy, and Melissa McDonald, Executive Director of Feeding Kentucky. I'm going to pass things over to them in just a minute, but first I want to go over a few housekeeping notes. If you have any questions during the webinar, you can put them in the chat and we'll address all questions at the end. There are no pre-approved CE credits attached to this webinar, but I can provide a certificate of attendance for joining. My email is up on your screen right now. If you want that certificate, please email me either this afternoon or early next week. The subject line should say request for certificate of attendance, and the body of your email just has to have your name. I'll also include these directions in a follow-up email after the webinar today. A little bit about the Foundation for a Healthy Kentucky. We are a nonprofit organization funded by an endowment that aims to transform our state so that every Kentuckian has what they need to live a healthy life. Our mission is to address the unmet health needs of Kentuckians, and our focus areas are access to healthcare and children's health. We do our work through policy advocacy, we build partnerships and bring together constituency groups, we fund research and data, and we fund and support community interventions and projects to improve the health of Kentuckians. So we know that access to healthy food and just food in general is vitally important to a person's well-being. Food insecurity is far too common in Kentucky, which is why initiatives like the Supplemental Nutrition Assistance Program, or SNAP, are super important, but the program often gets unfair and untrue criticism. So it's really important that we are messaging it correctly and uplifting all the good that it does. So with that, I'm going to turn things over to our two speakers to dive into the topic.
Great, thank you, Allie. I'm going to go ahead and share my screen before we get started. There we go. Okay, hi, I'm Jessica Klein. I'm a policy associate with the Kentucky Center for Economic Policy. We are a nonpartisan nonprofit organization that works on the quality of life of Kentuckians through research and communications, and I specialize in food assistance. And I'm joined today with Melissa McDonald, the Executive Director of Feeding Kentucky. And as Allie mentioned, our goal today is to really talk about that narrative around the SNAP program, going to go into the state of hunger and food insecurity in Kentucky, share more about the program itself, who uses it, what are the benefits, and some threats to the program that we've seen at both the state and federal level, along with a toolkit around advocacy for you to be able to participate in advocacy around the program. My goal today isn't for you to be a super expert in the program, but I want to make sure that you have the tools and resources that you need to learn more about it and to really be able to advocate on behalf of the program and, again, shape that narrative of what we're hearing around food assistance and food insecurity in Kentucky. And with that, I will turn it over to Melissa McDonald.
Well, good morning, almost good afternoon, and happy Friday. I am excited to be able to be with you today. Feeding Kentucky, if you aren't familiar with us, we work collectively to create a hunger-free Kentucky where we envision all people having access to enough food to thrive. Jessica, if you'll slip it to the next slide. And we do this in partnership with many partners across the state with our 120 counties, but we specifically work directly with the 7 Feeding America partner food banks. Thought I'd share a slide with you all so that you could see the location and what food bank could be covering the county where you may possibly be sitting in. Or where your work resides in. I would love to connect with you later if you have more questions about Feeding Kentucky, but I thought it would be great to set the stage when it comes to what does hunger in our state look like. Go ahead, Jessica. So one thing to note, we are very privileged to be able to have the opportunity to work directly with Feeding America underneath kind of their umbrella of programs. And one thing that I would highly recommend you do, and some of the information that I'm sharing with you regarding hunger in our state comes directly from Map the Meal Gap data. Feeding America has been doing this data since 2013. They provide this about every year to 2 years. And you can definitely jump in. It's a very interactive site. And where you're able to put in your county, you can see directly down to the county level of what your food insecurity levels are for all ages in that area. Next slide, please. Great. So I love maps. A good map is a very helpful thing. If you are from Kentucky and you know your maps, you know your counties, don't have them all identified on here, but you definitely can see where the numbers of hunger lie. We know that right now what we're looking at is about 15.7% of Kentuckians are struggling with food insecurity. We've seen that change. That is higher than the national norm, which is not where we want Kentucky to be. We know we're great in a lot of areas, but food insecurity is one that we do not want to be top in. We have around 710,000 individuals that are identifying of living in a food insecure household. And I think one thing that I want to pause with is looking at this pretty stark statistic of 20.7% of Kentucky children living in a food insecure home. It's important to understand that children, they are struggling with food insecurity at an early age. It definitely sets them up for potential lifelong health impacts. We know that students cannot learn if they are not fed. We also know that developmental delays can definitely be tied to food insecurity. And so we have to really figure out how can we make sure that there are opportunities for kids to eat 365 days a year, whether that be with the school nutrition programs in their school districts, a preschool feeding program, with an after-school program, summer programs, and then also like today, what we're going to be talking to you about with SNAP. We really want to make sure that we can help get this population taken care of with any type of food assistance programs. I also will note that sadly, we are one of the top states with senior hunger as well, with about 7.7% of Kentuckians that are also living in food insecure households. And then another thing to note is 9 out of 10 counties that struggle with food insecurity across the country are rural. And you can see I pulled out the top 10 counties in Kentucky that actually are part of the top 25 nationally. And they are located in Eastern Kentucky. So God's Pantry Food Bank is the Feeding America partner food bank that covers that part of the state. You also might need to just, remind yourself when it looks like the 2022 flooding and then the flooding that just happened 2 weeks ago, it hit a majority of those counties. And so when we look at food insecurity rates, we really have to keep all of those statistics in our mind. But one last thing that I will leave you with on this slide is to understand that food insecurity is actually identified to be in every single county of the United States. So if you've encountered me in any meetings or other opportunities to talk, food insecurity does not care about your zip code. It does not care about your demographics or your geographical location. It truly could be your neighbor, could be sitting in a food insecure situation. So it's something that we need to pull our head out of the sand and to be able to pay attention to and figure out how we can come to a collective to be able to solve this. Next slide, Jessica. And just one last thing, because it does hit racial disparity sections. I just wanted to show you over time, and this is looking at the Map the Meal Gap data. One thing, anytime we show this data, is we don't want to have you know that you can compare year to year because of that lovely pandemic that we all went through. The numbers of food insecurity in any collective, if you're looking at the pandemic, cannot be truly compared to what we're sitting with today. So I give you this data to be able to just see the growth and to be able to understand what it's looking like from white, Hispanic, and Black populations over time, but definitely suggest that you dig in a little bit deeper if you're interested in looking at the racial disparity part. And now I'll turn it over to Jessica to jump into SNAP.
Thank you, Melissa. And to get us started, I want to do a quick little poll. So if you can enter into the chat what you think our #1 tool against the food insecurity that Melissa was describing is. What do you think that it is? Is it, investments in agriculture? Is it food banks? Is it a program? What do you think it is? Let me see in the chat what you think. All right, I'm seeing a couple. I know that, the chat is disabled for now, so you can't really share too much. But I will say, if you're in the right place, then you guessed it's the Supplemental Nutrition Assistance Program. So this is our #1 tool against hunger in the nation. Investments and changes that reduce barriers in this program help to end hunger. So I really want to emphasize the importance of this program, and that's what you're going to hear a lot from me today. So a little bit of background on SNAP, the Supplemental Nutrition Assistance Program, is that it first started in 1939, and that was originally called the Food Stamp Program. For those that were around, it started as actual stamps on paper that you could pay for groceries in a grocery store, and then eventually became what we know today. So decades later, what we know today is that SNAP feeds over 42 million people, including 13 million children nationally. It's regulated by the Farm Bill, which is a national piece of legislation that changes every 5 years or so. We were supposed to see a version in 2023, and we're still kind of waiting on that. And it's administered by the U.S. Department of Agriculture, and then goes down to states to administer statewide. So in Kentucky, that's our Cabinet for Health and Family Services and the Department of Community-Based Services that administers that program. And what it looks like is it provides grocery money to low-income Kentuckians on an EBT card, or electronic benefits transfer card. And it helps people keep food on the table. It reduces food insecurity by 30%. So many Kentuckians, again, your neighbors, are just one lost job, accident, or new baby away from needing help from Kentucky's safety net, including programs like SNAP. So what does SNAP look like in Kentucky? Our participation varies depending on the month. The program is also very receptive to two things: the economy and then policy. So it's a lot of the changes that you see in this chart on participation over time is reflective of both of those things. You'll see a change since 2018, an increase. And then again, through the pandemic, you could see kind of a sharp increase there to reflect, the change in need that we saw in terms of food insecurity. There's also a couple dips that are related to specific policies that we passed in Kentucky. So 2016-ish, there was a shift in work reporting requirements, which I'm going to talk more about. And then even a gap in participation in 2019 when the government shut down. There's a month gap in participation. So our average benefit is less than $6 a day. For an individual, it's about $163 per month. Or for a household of 3, it's about $370 per month on average. But the amount of benefits that you receive is dependent on a couple of things. So it's dependent on a calculation based on your income, the number of people in your household, and then a series of deductions that you might see. So things like medical expenses or housing is another one. So in Kentucky, that's about 582,900 people that participate in the program. And in the last year, that stimulated local economies with $1.4 billion in this federal money that was spent in Kentucky. So again, it's a federally funded program operated by the state. And despite this high rate of participation, we actually rank pretty low in terms of reaching the eligible families. So there's really this gap of people who are food insecure that haven't been able to access the program. And we could talk about a couple of reasons why. Stigma of the program being one, which is why we're talking about this narrative change for the program. And then nationally, to dispel some myths around participation, people are only on this program for an average of 8 months. The range I've seen is really 6 to 12 months of participation. And again, the program is designed so that as you increase your income, that your benefits decrease with the goal of eventually getting off of the program, but that it's really there to support you when you need it the most. So who uses SNAP in Kentucky? So I mentioned the eligibility a little bit. So in Kentucky, we use 200% of the federal poverty line in terms of eligibility, but it also considers net income, which is 100% of the poverty line. And again, those benefit amounts just depend on this calculation. So you might have deductions based on medical expenses, shelter, utilities, those kinds of things. And in Kentucky, again, we reach about 585,000. About 40% are children, and then about 73,000 are people over 60 and people with disabilities. So those are really kind of the three groups of people that SNAP reaches the most. And in addition to that, SNAP also helps working Kentuckians. So it helps 1 in 10 Kentucky workers make ends meet. And that's, it's for many reasons, but one being that many Kentucky workers earn too low wages, they have too few hours or inadequate benefits like sick or parental leave, and they simply can't find a job in their area. Those are kind of the main reasons. Kentucky people who are working will have to utilize this program to really help make ends meet for their family. And so what are the occupations of people that are participating? So again, this is people that, are working, but just don't make enough to be able to afford their monthly groceries. So that's, a 1 in 4 chance that the cashier at the grocery store or the chef at the restaurant you're at uses SNAP to help put food on their table. So what are the benefits of the SNAP program? I wanted to talk a little bit about the health benefits. So SNAP, I mentioned, reduces food insecurity by about 30% nationally. But we also know that that reduction in food insecurity has lifelong benefits for both children, particularly for those who are nutritionally at risk. So that's children and older adults, right? People who are chronically ill really need access to consistent food. So for children, we know that that has lifelong impacts. SNAP is associated with better rates of diabetes, obesity, hypertension, a lot of those chronic illnesses. And then participation overall has a reduction in healthcare costs. Again, it's kind of hitting that preventative side. We know that SNAP participants are more likely to engage in preventative health behaviors as well. They will access healthcare more readily. They will adhere to medications, and they will have fewer hospitalizations and ER visits. So again, that contributes to the cost, as well as a decrease in those kind of chronic diseases that we often see associated with both low-income Kentuckians and with people that face food insecurity. So in terms of economic benefits, obviously the health spending is one. This map really has a good show of healthcare spending, and you can really see it's the similar areas of food insecurity on Melissa's map are the same, where we spend the most money on healthcare because of food insecurity. And in addition to that, for every $1 spent in SNAP, it generates almost $2 in economic activity in local communities. So because the program is quickly spent, people buy groceries on a weekly or monthly basis, right? So they're frequently going to the grocery store to spend these benefits for what they have. Again, it's only $6 a day, but knowing that they have that, they're able to kind of quickly spend it. And then it's spent in a local food retailer or a farmer's market, and that helps to generate economic activity in a local community. And with that, it's, SNAP is a key tool, anti-recession tool during an economic downturn. So you'll often see further supports in SNAP during a recession in order to boost local economies, since it has that generative effect of for every $1 spent, you get back two. It's also helping to feed more people. So SNAP feeds 9 meals for every 1 meal provided by a food bank. I know food banks are often seen as kind of like the #1 resource for food insecurity, and they are, key emergency needs in communities, and we're so thankful for them. But we do know that they're supposed to be an emergency and not something families are relying on a monthly basis. So we know that SNAP really is able to feed 9 meals for everyone by a food bank. So how does this program impact school districts? So I mentioned kind of the impact to local economies, but it also impacts schools for several reasons. One is that, family or schools rely on low-income families in their school district to be able to utilize the SNAP program. They know that if they have access to that program and are participating in it, that they could rely on that number to qualify for other food assistance program in their school, right? Because it's kind of an indicator of income and food access in their community. So it helps schools reach more kids with the free school meal program, and it saves on administrative costs and staff time because they're not having to survey every single student on their income and their food security. So that participation, we know, also boosts the school nutrition department revenue because it increases the number of meals that get full federal reimbursement. So school meals get more reimbursement for kids that participate in SNAP than for students that don't. So these are, just really key. Our school nutrition directors are having to do this really complicated budget analysis every single year to figure out what school nutrition programs they're going to participate in. And knowing that the families in their community can use the SNAP program is a huge part of that calculation. So just want to emphasize kind of the everlasting effects of SNAP, that it really has a huge impact on communities overall.
Jessica, can I add one quick thing to that?
Please do.
I think it's really important that when we see any challenges to reducing SNAP dollars, to reducing any of this, is a huge trickle effect. And so school districts will hear that. They will eventually see that. So just a little, when there's a reduction in SNAP, school districts do feel that when it comes to what they're able to provide.
Thank you. Okay, I have another poll, but I know the chat isn't working, so you don't have to enter into it. But just like a quick reflection on, do you know what the SNAP education program is? Or the SNAP employment and training program? Because those are two key programs provided by SNAP that most people don't know about. So I'm going to talk a little bit about these supports as well. So SNAP Education, or SNAP Ed, is an evidence-based program that provides nutrition, shopping, and cooking education around healthy lifestyles for both adults and children. Again, this is a support that's provided along with the SNAP program, but I do want to dispel any myths around like, oh, we're spending all this money in SNAP and it's going to all of these different programs. That's not true. 92% of SNAP dollars go directly to food, but we are lucky to have this kind of shared administration at the state and federal level on these two programs to support SNAP. So again, SNAP Ed provides that nutrition education that we know is so important, especially when people are trying to make ends meet and have these really tight food budgets that they're working with. And these programs, many of them are operated by area agencies, and I think at a few other community centers. But they can also, like there's a Cooking Matters class. I know our food banks do some of these programs. You'll see them sometimes in schools, senior centers, community centers. So if you're not familiar, I have the link on here. Definitely familiarize yourself with SNAP Ed and the resources in your community. SNAP Employment and Training is another resource provided by SNAP. Again, this is federally required that SNAP programs provide this support, but it's up to states what it looks like. So in Kentucky, we have a SNAP Employment and Training program. It provides work training skills and some basic supports like transportation and childcare, with the goal of increasing employment and sufficiency for SNAP participants. So I'll talk a little bit more about that because there's definitely some policy pieces that come up with the SNAP Employment and Training Program. So to switch us to policy a little bit, I do want to talk about these recent threats we've had to the SNAP program. So over the past 6 years or so, we've seen several kind of, policies that would create barriers and threats to SNAP. And it's a little confusing why, because I've just spent all of this time talking about all of the amazing benefits of the SNAP program, for both food security, for health, and for our local economies. But, since 2019, we've seen these different bills. And really, what a lot of them are coming from is model legislation that's being kind of shopped around to different states. So they're not specific to Kentucky, but they're really, the origin of them is from a Florida-based think tank known as the Foundation for Government Accountability, or FGA. They also have a lobbying arm called the Opportunity Solutions Project. So if you've heard of either of those, the same funded organization that shop around the same sets of model legislation to particularly red states, to dismantle safety net programs in general and particularly the SNAP program. So these are the different bills we've seen. They've created barriers to SNAP in different ways. Most recently is House Bill 279. And we also have a bill this year that's not one of these model legislations called Senate Resolution 18. So I'm going to talk about both of those, but also a few of the threats we've seen in the past. I know that these, it's probably not the last time we're going to see this kind of model legislation shopped around. So just want to talk about these bills and how they would take food away from Kentuckians and worsen food insecurity. So the first is House Bill 279. This is known as the Restriction on SNAP Purchases bill. You might also hear it about junk food or accessory foods is actually the language in the bill, but kind of removing those foods as options to use your SNAP benefits on. So I know at its face for a lot of us kind of health-focused folks that, the idea of nutrition requirements sounds like a great thing. But what we know is that restricting SNAP purchases really it's not a public health approach to improving healthy food shopping behavior or lifestyle behavior. What we do know is that participating in the SNAP program, though, does improve health, and that both SNAP participants and non-SNAP participants shop similarly in a grocery store. So here you can see for every $1 a SNAP participant or a non-participant spends, they're spending about 40 cents on the basics, vegetables, milk, bread, eggs, 40 cents on cereal, rice, beans, those kinds of things, the shelf stable types of foods, and then about 20 cents on kind of sweetened beverages, desserts, and salty snacks. So this bill aims to kind of target that, percent that people are spending on sugar sweetened beverages, desserts, and snacks. But it's just for SNAP participants is the issue. And really, we should be, if we want to improve Kentucky's health, we have to look at everybody and not kind of micromanage the Kentuckians with low incomes and hold them to a different standard is the issue. And so, we've seen this similar bills. It's sometimes called SNAP Choice, although it's taking choices away. So I don't really know the title for that. But We've seen it in 11 other states this year, so it's super popular language. Again, not evidence-based, but we do see alternatives to this that we think could be really great for the SNAP program. So things like increasing healthy options with SNAP by working on that SNAP education program I mentioned, or on a program called Kentucky Double Dollars, which is a program operated by a nonprofit in Kentucky called Community Farm Alliance, where you can spend with your SNAP card at a farmer's market or a participating retailer and receive twice the amount of fruits, vegetables, meat, eggs, and dairy for your money with the SNAP program. So that's kind of incentivizing people to shop locally. These are locally sourced products because it doubles the amount that they're able to get. So it's both healthier and kind of has that local sourcing. So that's definitely a program we would love to see expanded. It currently reaches about 30 counties in Kentucky, but definitely see that as an approach to improve healthier behaviors if that's the goal of this bill. So luckily this year, this bill was withdrawn. That means they're not going to vote on it. It's not going to move forward this session. Our legislative session is about halfway done. So we are still keeping an eye out on any other legislation that might come up impacting SNAP and are happy to share updates on that with our listservs. But for this year, this bill's been withdrawn, and that's great news since we know it's not an evidence-based solution. And I did want to share just this example from Indiana I thought was super clever. Because when you think of restricting SNAP, um, this is people's everyday grocery budget that they're spending, and SNAP is just part of it. Again, it's only $6 a day. So kind of micromanaging what they're spending that money on is really just rearranging the conveyor belt at the grocery store, right? Because we know at the end of the day, like the cost, if a grandma, say, is going to make a birthday cake for her grandson and wants to use her SNAP dollars and is buying groceries, um, buying a pre-made cake or even a box cake is like $6. And if you have to buy all of the ingredients to make a cake from scratch, it's about 24. So that's not really helping her groceries go further. And it's really, yeah, kind of the increasing the cost. And there's also some complications, like if health is the goal, then why are we restricting some things that might have similar nutritional values? So it's really hard to define what's healthy or not healthy in a programmatic kind of way. Like when you compare salted almonds to potato chips, the almonds might actually have higher fat. Like, what are the metrics we're using here? So kind of, it's a difficult piece of legislation, but luckily it's been withdrawn this year. So another piece of legislation this year is actually a support to the SNAP program. So we would love to see this one pass. This is just a simple Senate resolution, which kind of just makes a statement and encourages the cabinet to do a few things. So this one is Senate Resolution 18. It would encourage the cabinet for Health and Family Services to evaluate and report to the legislature on the SNAP employment training program I mentioned earlier. So this is, again, the one that provides that work training and supports. In Kentucky, it's highly underutilized currently. We're reaching probably less than 10% of the eligible population for this program. This program is particularly for people considered work age or work registrants in the program. So they're 18 I think 59 is the right number. So highly underutilized. We could definitely increase engagement, partnerships, outreach, and supports with this program. So would love to see this pass to take another look at how Kentucky operates our SNAP ENT program and see what more we can do. Now I'm going to talk a little bit about the bills we saw last year. These are pretty complicated, so I'm going to slow down a little bit for you in trying to describe House Bill 367. Luckily, last year, House Bill 367 was voted down in committee, which is rare. Usually they don't call a committee vote unless they know they have the votes for the bill to move forward. But last year it was voted down. We had many advocates for the program and participants come out to talk about how this bill would impact them and their programs because it had far-reaching impacts beyond the SNAP program. So I'm going to talk a little bit about those and how House Bill 367 would have taken SNAP away from over 64,000 Kentuckians. So the first piece is called BBCE, Broad-Based Categorical Eligibility, which is the program within SNAP that allows people to be eligible for other programs if they meet similar income requirements and verification processes. So in SNAP, if you participate in another public assistance program that has the same threshold for income and this other qualifications, then you can be kind of automatically eligible. So this is true in our school meals program as well. A lot of SNAP participants are categorically eligible for school meals. The other pieces that BBCE does, though, are critical to how we operate SNAP in Kentucky. One is that House Bill 367, by eliminating BBCE, would enforce an asset test in the SNAP program, which means people cannot accrue savings. They can't have a car over a certain value. I think it's $5,000. They can't have family land or family jewelry that is an asset over this certain amount of money. And having those things would disqualify you from the program or lower the amount of benefits that you qualify for. The second thing that eliminating BBCE would do is lower the income limit from 200% to 130%. So that's a huge difference in income for who would qualify for the program. 42 other states utilize BBCE. Several states that have eliminated BBCE have reinstated it because of all of the paperwork issues that it has caused. And also kind of just that shift that it makes for participants in terms of being able to slowly earn more income and receive fewer benefits. Eliminating BBCE makes it so that as you increase your income, there's kind of a rapid drop in your participation. So huge challenges with this. Again, we're not seeing this year, but there are threats like this at the federal level currently. So I just wanted to kind of go into this explanation so that you guys would understand it if you see this phrase again around as a threat to SNAP, that you would know what it is. The second piece I want to mention about 367 is another one that we're hearing at the federal level currently, which is eliminating a waiver from the work reporting requirement in SNAP. So currently, there is a work reporting requirement in SNAP, and there's an additional one for people aged 18 to 54 who don't have children in the home or a documented disability. This group has this additional work reporting requirement, but states are allowed to waive counties or regions that have high enough joblessness in that area or unemployment that it's going to be hard for them to find work and report on it. So they don't have to follow this work reporting requirement. What we know about work reporting requirements is that they are ineffective at increasing work outcomes and are very effective at creating barriers to participating in SNAP. So again, eliminating these waivers just kind of makes it so that people in areas where there aren't jobs have to do this additional reporting that we know doesn't increase work. It doesn't change work opportunities, and it doesn't create new career pathways. So another piece that we're seeing at the federal level, it's part of the discussion happening now around SNAP. So wanted to make sure you knew what this threat was. So those were kind of the two big ones last year that did not pass, but there was one more last year. One more last year, which was creating that the SNAP E&T program I've been talking about, the one that provides all those work supports, would have to be mandatory. And the issue with that is that a voluntary program really ensures people are able to access the different parts and supports that are relevant to them in their journey of trying to find work or earn new skills or get transportation help. But making it mandatory really puts their food assistants at risk of participating in a program that doesn't have capacity to help them. So as I mentioned, currently the participation in our ENT program is pretty low, and it's just really not equipped to serve all SNAP participants in Kentucky. So I think there's a lot of other, as I mentioned before, improvements we can make to this ENT program that doesn't make the program mandatory to receive food assistance. So those are the ones that happened last year. I'm not going to go into all of the potential threats in the world for the SNAP program, but here are just some of the ones that we've heard over the past few years. I mentioned the last 6 years we've seen a bill. Some of those include these threats, but all of them just create new barriers to participating in the program, and take away food assistance from Kentuckians that are food insecure. So I mentioned a couple of the federal issues that we're hearing, but what it really comes down to is the budget for the SNAP program is at risk. This week, the House budget reconciliation passed the House, and that proposal takes away Medicaid and SNAP from hundreds of thousands of Kentuckians. And also kind of pay for these tax cuts for the ultra wealthy. The issue is that a lot of SNAP participants participate in Medicaid as well. So taking away both their food and their healthcare at the same time is not great. So I do have a little bit of a call to action on this one. So the House budget passed the House this week. It's going to go to the Senate. It's up for discussion. The Senate kind of has their own version that they're working on as well. The deadline before we see a government shutdown is March 15th. So they have to make a final decision on this budget by then. So if you are willing and able, calling or emailing your federal senator, which is Mitch McConnell or Rand Paul, to say that you want a budget that supports Kentuckians by protecting Medicaid and SNAP, because we know that both of those programs are so essential to the health of Kentuckians, and without them, we are going to see huge threats to both of those populations and to the health of our state overall. So just kind of wanted to point to that, if these cuts to the SNAP program were to move forward, the office that administers the SNAP program would have to implement a lot of the barriers I've been talking about in order to shrink the budget of the SNAP program. So those are going to continue to be part of this discussion moving forward at the federal level. So I mentioned an advocacy opportunity, but I do want to provide a little more support in terms of what your options are for advocacy in Kentucky. And as part of that, I know some people, depending on your organization's position, your position in your organization, how you're funded, all of those things, there might be a difference on if you're able to advocate or lobby. I know the phrase lobbying often scares people of oh, I don't want to do that, or I don't know how to report that, and those kinds of things. But really the difference is advocacy is about education and educating decision makers on an issue or a program, and lobbying is asking them to vote for a specific bill for those reasons. So you can educate and advocate, and you can lobby. Both are great, especially when decision makers are making decisions. So whichever you're able to do, just wanted to kind of clarify that there are differences. And in terms of how do you know who to reach out to, the best way is to find your state and federal representatives in both the House and the Senate. I have links to that on the next slide. But I did want to share links to, if you are looking up that person, see if they're a part of one of these committees. These are the committees that we've seen SNAP policies in. So some, it's obvious, like health services, families and children, agriculture, that makes sense. You might not expect state government or licensing and occupations to have a SNAP bill, but occasionally it happens. So it's good if you're looking up your legislator for the first time to kind of familiarize yourself on which committees they're a part of, what issues are important to them, if you're going to talk to them about the SNAP program or hunger in Kentucky. And then in terms of how can you advocate, one way is to reach out to your legislator and just get to know them, right? So inviting them to learn more about your work, the people you work with, hunger in your community, invite them to your program if you have one. Those are all great ways. This is the legislative hotline. This is the number you call if you have a specific bill you want to talk to a legislator on. And then if you want to just learn more about policy and get updates, you can join the Kentucky Food Action Network. We often share calls to action, research updates, information around the SNAP program, and about many other food assistance programs, and more about our food system in Kentucky. So this QR code will also take you to that website, the Kentucky Food Action Network. Both KY Policy and Feeding Kentucky are part of it, along with Community Farm Alliance and Kentucky Equal Justice Center. Our 4 organizations lead that group together. And so that group, yeah, you'll receive all of these updates, but it's also just a network of food advocates and individuals affected by the food system across the state. So a great resource overall. So you can connect with them, you can find your legislator at this link, or you can join the Thrive Kentucky webinars. We are a safety net coalition, so we talk about lots of programs, including food assistance, but also housing, education, healthcare. So if you're interested in getting monthly federal and state policy updates, that's a great webinar to join on a monthly basis. So this is a list of all of those organizations and coalitions to follow on social media, to check out their websites and sign up for their newsletters. I also put the USDA website for SNAP on here if you kind of want to learn more at the federal level of what's going on and how to apply at our Department for Community-Based Services is here. I think that's all I have in terms of sharing out. I know it's a lot of information I shared, so I'm open to questions now if there are any.
I know the chat wasn't working earlier, but I do believe the Q&A function is. So if you have questions, you can put them in there. There are a couple that I'll go ahead and start with. I think this question was in regards to the education and training programs. I wonder if incentivizing participation would help, like a $30 credit to do the class or something like that. Do you have any comments on that?
Yes, currently there is, it's not an incentive to participate. Again, that would require additional state funding, which we're currently not seeing a ton of support for. But there is a transportation voucher that's supplied. So if you do have to go in person to a work training or to kind of get those skills kind of on the site training, those kinds of things, they'll provide you $25 to help with that transportation cost.
And now this one question is about the Double Dollars program. For farmers market double dollars, has there been any discussion about federal or state funding covering at 100% versus the farmers market having to cover the cost of the double dollars?
Now, wouldn't that be great if it was state or federally funded? I think maybe we could expand to the whole state if we had that. I will say, so the nonprofit Community Farm Alliance, they're the one that administers that Double Dollars program in Kentucky. And they do receive a federal grant, I believe, to help cover the cost of that, but it is a share. So it's not 100% of the program. Also, to offer all of the benefits that they do in that program, they have different sources of support. So it's not all federally funded.
But I will say, the Representative Lockett, who pushed for House Bill 279 this year to put restrictions on SNAP. We would love to be able to have some more support to be able to approach him to look at shifting the narrative to a healthy incentive. And to actually have that be an opportunity where you could do more double dollars. And it would not just be looking at increasing with farmers markets, but then also looking at more retail. And so we've been working with Community Farm Alliance on conversations around this. So keep your fingers crossed and we'll keep you posted.
Yeah, definitely something we're going to keep talking about for sure.
Another question is, do you know the percentage of SNAP enrollees that typically utilize the education and training programs?
Yes, so I mentioned that the SNAP employment, of course, I'm going to get like really bogged down right now, but the SNAP employment and training program aims to reach that group that's called work registrants. So people that are, they're not college students, they're not taking care of kids in the home, or that they're not, over the age of 60. This is the group they're trying to reach with that program, right? To help them get the skills and basic supports that they need to get to work. So that group is about 90,000 participants out of the 580. Last time I looked on a monthly basis, it's about that much. And then of that group, a very small percentage participate in the ENT program. So again, it's targeted to this specific group who is, in work age, but is a voluntary program, so even fewer participate. There are 5 partner agencies in Kentucky that operate that ENT program. So they also have to be like close to one of those 5 organizations in order to be able to access the program.
Another question is there a time limit that someone can stay on the program? Is the statistic of the 8 months average for working families or for everyone on the program?
8 months is the national average for SNAP participants, so it includes everyone. There is not a time limit, but there are time limits associated with certain pieces of the policies of the program. So, for example, I mentioned there are additional work requirements for this group of people without kids between 18 and 54. That group has to report their work of at least 80 hours on a monthly basis. And if they miss 3 months in a row, then they lose their SNAP benefits. So that's kind of it's often called the time limit. So if you see that phrase, that's what that's referring to. So there isn't a time limit for how long you can participate in the program. It's, do you meet all of the eligibility? Have you done all of the reporting? Are you consistently using the benefits? Those kinds of things come into play.
I'm not seeing any more questions right now, but I have seen several comments about how people have said they'd love to advocate and lobby and how useful this has been. So thank you so, so much to Jessica and Melissa. This was a great presentation. I really appreciate it. And if there are no more questions, we'll go ahead and sign it off there and have a great rest of the day, everyone, and have a good weekend. Thank you.